Gynecologists, what's the worst thing you've ever seen? The gynecologist is here. There are unpleasant cases, like when a girl goes days, weeks with one tampon. Necrotic vaginal cancer looks bad too, but it's nowhere near the worst case I've ever seen. A 19-year-old girl once came to my clinic complaining that she had a hairspray cap stuck in her vagina. At first glance it didn't seem to be a problem, but the problem was that she had stuck it in there when she was 15 years old, that is, 4 years ago. The motivation for this act was unclear, and it was obvious that she was very ashamed. Already before she undressed, you could smell a terrible odour which got worse when we started to investigate the problem. The lid was shoved edge to edge, and it was evident that it had become well engorged with vaginal tissue over the 4 years. The difficulty of cure was further compounded by the fact that this lid had pierced both the bladder and rectum. Several extensive surgeries had to be done to get it out. I'm not a gynecologist, but I know someone who recently had a hysterectomy, an amputation of the uterus. Basically, the girl had stitches in her vagina that needed to be allowed to heal, but she was so anxious to get back to sexual activity that she couldn't stand it and snapped, causing her small intestine to fall out of her vagina. According to the girl herself, as she was travelling to the emergency surgery, she could feel the intestine lying on her legs. My father told me about a woman who had a severe heroin addiction. For some unknown reason, one day she decided to get creative and injected herself in her labia, which resulted in gangrene. When I had an internship in gynecology, I was sent to examine a young lady. As I was getting ready for the examination, the odour in the room was such that I began to think I was in for the worst bacterial vaginosis I had ever seen. I climb inside and start examining everything, but I don't see any unusual discharge. That's weird. I start to move backwards and feel that the further I move back, the stronger the odour. Turns out her feet were just stinking wildly. I highly recommend everyone to read Dr. Lisa Rankin's book, Vaginal Thunder. There's a section where she writes about some of the worst cases in her career, like finding dengue larvae and so on. But that's still flowery. The coolest case was about a woman who sprouted potatoes there. Anyway, the woman decided to put a potato inside herself as a contraceptive measure. Well, since potatoes love warm, dark, moist spaces, they started to grow vigorously, and eventually she had potato sprouts dangling out of her vagina. I have a non-vaginal story, but it's no less disgusting. When I was in high school, I got involved with a student organization that sent high school students on internships. I decided to go help out in the trauma room. One time, a very obese woman is brought in complaining of chest pain. Everyone can smell an extremely horrible odour coming from her, so the doctor decides we should clean her up. To watch her, that is. He washes her, lifts up one of her breasts, and from there it starts to go so bad that we all almost fainted. There was a small crust under the breast, which the doctor tried to wash out, but the crust wouldn't come off, and as a result there was a small hole, from which cockroaches seemed to have started appearing. Probably eggs had been laid under the folds under the breast, and when they hatched, the cockroaches couldn't find their way out, so they had to chew their way free. I had a story that I think is one of the most disgusting I've ever heard from the medical community. One day a woman in her 50s, very obese, 227 kilos, approached them. She reported that her husband was complaining of a strange odour during intimate relations. But the interesting thing was that not only her husband could smell this odour, but the whole hospital. Anyway, I don't remember all the details, but in the end it turned out that she had necrosis in her vagina. Surgery was required, but it didn't save her. She died. I'm not a gynecologist, but I've seen a lot of strange things. For example, I've seen a woman with vaginal cancer. After having her vagina and cervix completely removed, it wasn't the most pleasant sight. I can't describe the whole procedure exactly, as I was a very young student at the time, but in the end, all that was left was a big hole with something leaking out of it. The poor woman was so consumed with grief that she begged her husband to leave her, saying that he could never love her after that. But he was a good man, staying by her bedside all the time, holding her hand, comforting her, and feeding her with love. The second story was when a woman weighing 220 kilograms was admitted with paralysis of the lower limbs. She had a giant ulcer and necrotizing fasciitis that had destroyed everything in the genital and buttock area. When the doctors asked for a urine sample, it turned out that her bladder was gone and so was her vagina. We then proceeded with a procedure that involved inserting gauze into a large hole. She ended up dying very quickly. I pity everyone who gets into these situations. Once a girl came to the clinic complaining that she could not get pregnant, and she had diarrhea all the time. The gynaecologist asks, "How often do you have sex up the arse?" And she's like, "Always, of course." Turns out her boyfriend has convinced her that it's easier to conceive through the arse than through the front. So she asks him to only have sex from behind. I have a colleague who's a gynaecologist. He's a funny guy. A girl comes in for a checkup, so he puts her on the chair, and then my colleague puts his fingers on her cervix. And at that moment, I asked him such a brilliant question. "Did you think that this is like stuffing a turkey?" He naturally tries to be serious. "Well, no, of course I never thought of it. But now I see. I'll have to remember it for years to come." And the patient is just laughing, looking straight into my colleague's eyes, as if she were a turkey, and his fingers are still there, in her. My grandmother, worked as a nurse on the gynecology ward for 20 years. One day she came home all pissed off, and she's screaming, "If I see one more vagina, I'm going to kill somebody." The next day she quit, and my mum's a gynecological assistant, so I've heard a lot of stories from her. I remember a woman ran into the office and she smelled like a rubbish dump. And she'd been wearing only yellow-brown pants for 2 months. Apparently nobody told her to wipe her arse. My first visit to the gynecologist was weird. I was so nervous, and there was some old woman there, and she noticed that I was tense. And to lighten the atmosphere, she said, "Well, you are lucky you went to a gynecologist and not to a man. They don't have fingers, they have sards." And she stuck her decrepit fingers in there like that. When I was working as a medical assistant, a woman came to the doctor with complaints of unusual discharge from the vagina and a strange odour. Upon examination, it was discovered that she had forgotten her tampon inside for a fortnight. This was not only unpleasant for her, but also posed a health risk. I once had to assist in the examination of a woman who suffered from chronic bacterial vaginosis. The odour was so intense that even through a mask it was difficult to stand. This case reminded me how important it is to take care of your health and seek help on time. During my internship at a hospital, I encountered a woman who had a vaginal obstruction due to an improperly inserted medicated lubricant applicator. This resulted in severe pain and required surgical intervention to remove the foreign object. During my practice in a gynecology clinic, I had the opportunity to see a woman with advanced endometriosis. This was one of the most difficult cases I've encountered. The woman was in severe pain and had trouble conceiving. Treatment required a combination of surgery and drug therapy. A young girl told me a story about how she tried to treat a vaginal infection on her own using unconventional remedies, such as garlic tinctures and herbal oils. This led to serious inflammation and complications that required long-term treatment. One woman was hospitalized after she tried to remove a mole on her genitals by applying harsh chemical hair removal products to it. This resulted in severe skin irritation and burns requiring surgery. I met women who faced difficulties during pregnancy such as premature labor, hypertension, and other complications. These cases reminded me that pregnancy requires special attention to health and regular medical monitoring. I had to observe cases of women who faced complications after abortion such as bleeding, inflammation, and infections. Some of them delayed seeking medical attention due to fear or shame, resulting in serious health consequences. In my practice, there were cases of unusual tumors and neoplasms in the female genital organs that required differential diagnosis and surgical intervention. This reminded me of the importance of regular examinations and screening for cancer.